We're going to be talking about a common cause of lateral ankle pain, and that's peroneal tendonitis. The peroneus brevis and longus muscles are the lateral leg compartment muscles that form right around the lateral ankle, the two tendons. And the peroneus brevis and longus tendon course right behind the fibula bone, which is the lateral ankle. The peroneus brevis attaches to the base of the fifth metatarsal, and the peroneus longus muscle runs through the bottom of the foot, attaching to the base of the first metatarsal bone. Both of these muscles are very instrumental in stabilizing the foot and ankle during walking, and these are the muscles that would resist the tendency to roll your ankle. After one single ankle injury, we can actually see an injury occur to both the peroneus brevis and longus tendon. So the common forms or common causes of peroneal tendonitis are injury associated with, for example, an ankle roll or an ankle sprain. Very occasionally we'll see overstress to both the peroneal tendons with people who have high arches. So during their walking cycle, based on the arch structure, there tends to be more increased stress to the tendons. This patient specifically, what we can see in this region, and we'll compare to the other foot, there's swelling, essentially diffuse swelling along the course of the tendon, and there's very localized pain right behind the ankle. And these are two clinical features of direct localized pain as well as swelling that have us a little bit more concerned for the possibility of actually having a tendon tear. A tendon tear or an attenuation, which is sometimes lengthening and weakening of the tendon, is generally picked up on clinical examination of the foot and the ankle, the location of the pain, but also diagnostic imaging using, for example, an MRI. An MRI or magnetic resonance study will show us tearing, areas of thinning to the tendon, and this patient does actually have a tear to the peroneus brevis tendon. When we're testing for muscle strength and testing for peroneal tendonitis, generally what we'll do is have the patient push against our hand. So go ahead and push against. And as I'm having that patient resist that push, what we're isolating is both the peroneus brevis and longus. And when we're palpating, where I'm poking through behind the ankle, we're really experiencing discomfort or pain in this region. Treatment for peroneal tendonitis generally includes rest, and how we rest patients initially is by immobilizing and decreasing the workload of the peroneal tendons. We'll sometimes use a removable walking boot depending on the severity. We will very oftentimes use at least temporarily ankle bracing for support. And for someone who's quite functional during their walking day but with persistent tenderness, we'll oftentimes use a very stable or supportive shoe, plus an orthotic or an arch support, which we'll show later, that decreases the tendency for that foot to roll in during the walking cycle. So it's a way, by posting with use of an orthotic, of decreasing the stress on that area. This is demonstrating a standing position of a patient who has peroneal attenuation and tearing to the peroneus brevis tendon. We're again talking about the lateral leg compartment, the peroneus brevis and longus tendon course behind the ankle and the fibula bone. This patient actually has a very functional foot in that we look at the overall heel position, and the heel position is straight up and down. If the peroneus brevis tendon has been torn and thin, a lot of times what we're going to see is that the heel is in a very turned in position. So with the heel on the ground fully, what we're actually seeing is that the heel position is in a varus attitude, and it's increasing the amount of stress to this outside area. This patient, as he is standing normally, clearly we see a very good stable position of the foot in stance, and that the heel bone is perpendicular to the weight-bearing surface. This is the unaffected foot, and you notice the peroneal tendons, there's not the level of swelling or fullness to this outside ankle area. So this is the asymptomatic foot. This is an example of a very stable supportive shoe. We have a wide base of support in the outsole material. This is a New Balance shoe. What we're actually seeing is we essentially have both medial as well as lateral, and this is the outside portion of the shoe, stability with the use of a roll bar. This is a really important key feature for people with peroneal tendonitis. Generally, we're trying to use the shoe to support and decrease foot pronation. For this patient, we're actually trying to stabilize the outside portion of the foot so that the foot does not have the tendency to roll in. So the shoe and the orthotic, and we'll demonstrate the orthotic momentarily, will provide that lateral or outside support to decrease that tendency to roll in during the walking cycle. Oftentimes what we'll do for treatment is we will use a supportive shoe as demonstrated, but we'll oftentimes use an orthotic or an arch support. And as we have a patient lift the ball of the foot up, and we're now having him stand down, what we're trying to do is use an insert or an orthotic to post, or what we call create a valgus post, to decrease some of the mechanical stress on the perineal complex. So an orthotic that we will commonly use, in fact, will have a supportive post on the heel post itself and as well as the front edge of the orthotic. And this orthotic, as we have a patient stand on it, go ahead and lift up and stand, will essentially create some of that valgus lifting that we were talking about momentarily. So the shoe and an orthotic ultimately act as a tool to help stabilize the foot and the ankle and decrease the mechanical load on the perineal tendons. By stabilizing the foot and ankle, decreasing the mechanical load on the tendons, we'll generally see a decrease in the symptoms as they relate to peroneal tendonitis, and some symptoms as they relate to perineal attenuation. Someone who truly has chronic tendonitis, we have to be worried and concerned about tearing of that tendon, and it always deserves, this is an injury that always deserves medical attention and evaluation. A thorough evaluation is essential.